Good afternoon, everyone, and thank you for all of you for joining us here today. I want to thank Dr. Rusin for being here, and thank you and your team for giving up your holidays to keep Manitobans informed as we learn more about the newest COVID-19 variant, Omicron, and its impacts on our communities and on our healthcare system. As with many jurisdictions in Canada and to the south of us, case counts are rising rapidly, and we must do everything we can to ensure our healthcare system can continue to offer patients the care they need when they need it. As those case counts continue to rise, so does the demand for testing at sites across the province. As a government, we continue to explore options to increase our capacity and alleviate wait times for those seeking a test. Starting today, take-home, self-administered rapid tests will be available at provincial testing sites, as well as at other locations to help protect vulnerable Manitobans. When an individual visits a testing site, the type of test they receive will now be based on their vaccination status. These changes are being introduced incrementally and will help manage current and growing demand for COVID-19 tests. Additionally, rapid test kits will soon be available at Manitoba Family Services offices, through child and family services agencies, as well as community living and disability services clients living independently. Manitobans are seeking a COVID-19 test for out-of-province travel purposes should not attend provincial testing sites. Rather, they should seek out a private provider. Our number one priority is to protect the health and well-being of all Manitobans. We continue to have some of the most stringent public health measures in the country to minimize the spread of this virus and protect our most vulnerable. I want to thank Manitobans who altered or canceled their Christmas plans to help minimize the spread of this highly contagious virus. Now, as we approach the new year, a time that is usually filled with celebration, we are once again urging Manitobans to limit your close contacts at this crucial time in our fight against COVID-19. And so today we are here to announce additional measures to limit gathering sizes in all public places to help mitigate community transmission and to protect our hospitals and the people who need them most. With that, I'll pass it over to Dr. Rusin to expand on the new public health orders. Dr. Rusin.
Thank you, Premier. Good afternoon. I'm Brent Rusin, Manitoba's Chief Provincial Public Health Officer. As we forecasted last week, we're seeing increased daily COVID-19 numbers. Since Friday, we've reported 2,154 positive cases. These increased case counts means we are seeing an increase in demand for testing, and that increase in demand is resulting in increased wait times, both to receive the test but also to receive the test results. And so as that demand has increased, we've also seen now this backlog of tests. So we are certainly under-reporting the number of positives that that are circulating. We know that Omicron is here in Manitoba and circulating quite widely at this point. We've seen a dramatic increase in our test positivity, and I wanted to address that a little bit. We see 19% provincially and 21% in Winnipeg. So certainly our numbers are increasing, and we have a significant amount of transmission, as we see in our daily test numbers. The test positivity has been changed the way we can interpret that because of how we're deploying our rapid tests. So many people are getting the rapid test to test at home, and only those testing positive are returning for PCR tests. Therefore, we're skewing to a higher test positivity. So this is just one of the indicators we look at. It's now changed the way we interpret that number, but it is just one thing we interpret. But we also know at the same time we are seeing a dramatic increase in test positivity and cases at this point. So we do expect that test positivity rate to be as high as it is, and we'll continue to look at all other indicators as well. So we know that in the Winnipeg region, of the test positives, where we're seeing the majority of test positive right now, roughly 75% of those test positives are Omicron. So we see that Omicron is here, especially in Winnipeg. So again, it's taken over as our most prominent strain in almost all regions. So at this point, we're not going to continue to provide Omicron case data. We know that the vast majority of cases are Omicron, and that number is just going to continue to increase over time. So the vast majority of people who screen positive will be screening positive for Omicron as well. And so we know Omicron is highly transmissible. It's difficult to predict the exact impact Omicron will have on our healthcare system, but we know we need to be prepared for that. We know we can't rely on some of the reports of Omicron being less severe. We know with the amount of transmission we're seeing, we're going to see that demand translating into increased demand on the healthcare system. So again, we need to protect that healthcare system for everyone who needs it, all Manitobans who need it, which means we need to decrease the amount of transmission that's occurring with Omicron. So we already have orders in place that reduce capacity for private gatherings. Those have been in place for quite some time now in Manitoba. We're introducing new public health orders that affect the size of gatherings in public places. So effective tomorrow, we're reducing gathering sizes in public places for groups of vaccinated people. So gatherings must not exceed 50% capacity of the usual capacity of space, or now capped at 250 persons, whichever is less. So these capacity restrictions will affect restaurants, licensed premises, food courts, socials, movie theaters, concert halls, performing arts venues, outdoor ticketed performing arts events, museums, art galleries, outdoor and indoor sporting and recreational facilities, including dance studios and martial arts studios, gyms, fitness centers, and yoga studios, indoor and outdoor ticketed sporting events, indoor recreational businesses, seasonal facilities and events, religious services and indigenous cultural events, bingos, casinos, businesses, and VLTs. So these restrictions place capacity limits at these locations, including gatherings where all attendees are fully vaccinated or under the age of 12. So again, I want to reiterate here that this whole purpose of having capacity restrictions and reducing capacity size is to ensure there's distancing between clients. So we've heard of reports of different businesses where the overall capacity of their building is at 50, but they're cramming everyone into a single room. This is not the intent of the orders. That's putting those people, your customers, at risk of transmission. The 50% and the cap is there to ensure the distancing between clients. So please understand the intent of the orders. Please do what you can to protect your patrons as well as all Manitobans. So we're also introducing restrictions to curtail liquor sales at restaurants and licensed premises at 10 p.m. each day. We know these will change the plans of many individuals and businesses, but we're putting them in place now in face of Omicron and widespread transmission to try to limit that transmission. So we know hundreds of thousands of Manitobans have been vaccinated and continue to follow the public health orders, and I thank you for that. All Manitobans thank you for that. But these changes are necessary right now to reduce that risk of overwhelming the healthcare system. So again, we need Manitobans to limit contacts with others and only get together with immediate family. Really reduce those plans. These orders have now required the reduction in a lot of gatherings that were planned to take place, and we know that's difficult, especially this time of year, especially the second year in a row. But we all need to do our parts to reduce the amount of transmission by reducing the amount of contacts we have. So follow those fundamentals, stay home when you're sick, go for testing and isolate until you get your test results. So again, we know it's challenging times, we know there's a long wait to get tested, there's a backlog, so people are waiting longer for their test results. But a significant proportion of our test positives we can't get a hold of. So we're phoning people who are ill, who came for testing, tested positive, but no one's at home. And so that it's, I understand it's a difficult time, but if you were ill and needed to get testing, you need to isolate until you get your results. And we're finding a significant proportion of people went and got tested, but are out and about. So we really need to rely on Manitoba. Stay home if you're sick. So again, wear a mask, wash your hands, protect yourself and those around you by getting fully vaccinated. Get whatever dose you're immediately eligible for, whether that's your first, second, or third. We talked about those capacity issues at the testing sites. So again, younger, healthy individuals, those under 40, no underlying health conditions. If you're ill, you could consider just isolating for 10 days at home. You could still attend the testing site, get a rapid test and see what that shows. But either way, if you're ill, we need you to self-isolate until you get a test result. If you're not going to get a test result, it's for 10 days. And that's going to help preserve some of that testing capacity for those that are at risk of more serious outcomes. So appointments for tests are available at some locations, as well as drive-through, walk-in, walk-up. Check those locations and hours before you go, because during these times sometimes there's changes. When you go for testing, you can expect some of the longer lineups, although the strategy now with the rapid testing has significantly improved that. And that the current test turnaround can be up to 4 days or even longer. So again, if you're symptomatic, we need you isolating for that 10 days or until you get a negative result. Not what anyone wanted to hear this time of year, and again the second year in a row, but it's what we need to do. So I want to ask Manitobans to be patient as we work on ways to further alleviate those delays, and be kind to others. People in line are going through the same thing you're going through, all Manitobans are, so let's be kind to each other. Let's make it through this like we have before. Manitobans who are seeking COVID tests for travel purposes, please do not go to our testing locations where we need this for Manitobans who are ill. Go to private providers if you need this for travel purposes. We didn't want to celebrate another holiday this way. We've got to keep each other safe. We have to protect that healthcare system. So please be safe, please be kind, and thanks again. I'm going to pass back to the Premier now.
Thank you very much, Dr. Rusin. And we recognize that this news will be disappointing to many Manitobans as we round out the holiday season. But we must act now to protect our healthcare system and ensure Manitobans can access the care they need when they need it. We all have a role to play, and I'm confident that the actions we take now will help ensure a healthier year ahead. Vaccines work, and now more than ever with a new variant circulating throughout Manitoba, it is critical that all Manitobans get fully vaccinated, including a third dose when you're eligible. Just a reminder to follow the fundamentals, stay home when you're sick, get tested, wear a mask, socially distance, and limit your close contacts. We can and we will get through this together. Thank you, and we're now ready to take any questions reporters may have.
So you're announcing restrictions here at public places, yes, but why not the private places? I know there are restrictions in place for private, but I mean we're announcing 2150, roughly on 2150 cases here in Manitoba over the past couple of days. I mean we haven't seen these numbers in this province since the pandemic yet. With New Year's Eve coming up, why not implement more restrictions to the private? Because people are still going to get together. A recommendation is not going to really change people's plans from getting together for New Year's Eve. So why not just limit it to family only and households? Why keep that private option open?
So like you said, we already have restrictions in place, and they're in line with most other jurisdictions in Canada. So a fully vaccinated crowd could have household plus 10. Like you say, we do message. We want to limit that as much as possible. Unvaccinated crowd, only 5 plus household, which is amongst some of the most strict in the nation right now. So we do have measures on there. Messaging is always important. We know it's very difficult to enforce these type of orders in private residence. So I think the messaging is really important, and so we are getting that message out, but we do have pretty strong orders in place as well.
What's the projected impact on case counts given, a 50% reduction across the board of 250 people?
Yeah, and so I mean, these are always hard things to model because there's so many variables in place when we throw it in a model. Most of the models that we've seen from other areas that a 50% reduction in contacts is a very significant impact on the number of cases we see, which would translate in significant reduction of that strain of healthcare system. So what the actual impact and reduction of contacts is with any specific order, that's difficult to comment on.
Why no retail? No changes to retail?
Yeah, and so retail's always had restrictions in place. We wanted to remind Manitobans and our retail partners that those restrictions are in place, that they're required to have that 2-meter separation between patrons, which is quite a significant capacity limitation, and that can be enforced and will be enforced. Again, the nature of the contact within retail is different in a lot of these settings. The transient nature of walking by people is less significant, but be that as it may, we do have pretty significant restrictions.
Have you started discussions with any other provincial counterparts or Ottawa about ICU resources? Because of the case counts that we're seeing now, that's if the rate of ICU admission continues, it's going to be 9 admissions a day in about 10 days' time, and that's not. We can't do that locally. So how are we preparing for that?
Yeah, certainly we know that other jurisdictions are facing this as well, and so we obviously are working together to see how we can share and what best practices are. As Dr. Rusin has already stated, we have among the most stringent restrictions in place already across in Manitoba relative to across the country, and so when it comes to our ICU capacity, we have been training more nurses. A total of 147 new nurses have completed the 2-week general ICU nursing program in the last 10 months, as well as 70 nurses have completed the 12-week critical care program as well in the last several months. And so we are increasing the nursing capacity within the system. We are also looking at our internationally educated nurses as well, and looking to triage those to see how we can get them trained and working on the front lines. And those are some of the measures that we are taking. I have had discussions with the Prime Minister and our counterparts across the country, and I know that the Minister of Health has also been in touch federally as well, and we have received, I believe it's 8 nurses, or they will be sending 8 nurses to Manitoba to help out in the ICU. So considerable work has been done over the last several months to prepare for this, and but we will continue to obviously work with shared health and work across the system to see how we can make those improvements so that we have a healthcare system that's there for Manitobans when they need it.
So at this point, nothing additional to the 8 ICU nurses that have been committed to Manitoba?
Well, from the federal government, yes, that is the case, and I know those discussions are ongoing, and the Minister of Health has been in discussions with respect to more help from the federal government. But again, it doesn't mean that we stop what we need to do here, and we have been doing and taking those steps here to adequately prepare for this.
Dr. Rusin, do you think there will be a decoupling of cases, or do you expect that ICU admission rate to hold with Omicron?
You know, well, right now we're seeing some reports from other jurisdictions that severity may be less with Omicron. What we're saying right now is we can't rely on that. So we need to be cautious right now. If that does hold true, then certainly that's going to be quite helpful in our jurisdiction. But we can't rely on that. We need to do what we can to bring down the transmission right now.
I understand in Great Britain there are millions of cases of Omicron and comparatively few hospitalizations compared to the Delta. Do you think that could possibly play out here?
Well, we're still learning, and so those jurisdictions like UK are you know, a couple weeks ahead of us. So we're going to be able to get some insight in the coming weeks about that. So again, we can't rely on that because you know, given the severe trajectory of total case counts we could see here, even a dramatic decrease in severity could still put quite a strain on our healthcare system. So we're not going to rely on it, but we are watching that really closely, and we'll allow that to guide us once we know more about it.
You're jump to the phones now, and then we'll come back to the room.
Thank you. A reminder to our reporters on this session, you will have one preliminary and one follow-up question. Up first this afternoon from CJOB, Skylar.
Hi there, thanks for taking our questions, guys. The liquor one, we've done this a couple of times now. What's the thought process behind, excuse me, behind capping liquor sales at 10 p.m.?
Yeah, and so this is where we've seen transmission occur in many of the past waves. People gathering later at night. More consumption of alcohol, usually, especially coming up on this holiday season where there'll be many more celebrations. We just find it's more and more difficult to stick to some of the public health guidance in there, and we've seen a number of outbreaks, now a lot of transmission. So we cap that at the 10 p.m. It's that finding that balance. So we still have businesses open and able to operate, but we reduce some of the harms we have noticed where and when transmission has taken place largely.
Thank you for that. Getting some reaction to the news already, and of course there are people on both sides, but a lot of people were expecting more to come down from you guys today. What do you say to them if, you know, some people, yes, they can stay at home, you know, when possible, but some people don't have that option if they're working in public-facing roles, and they might be quite concerned about their risk of contracting COVID and then passing it on to their loved ones?
Yeah, I mean, I think that this is, again, like we've always tried, is to balance the response. So we have, you know, limits on many of the higher risk activities, and then remember we, you know, earlier this month had put on very significant restrictions, you know, prior to the large uptick in Omicron here. So we are adding restrictions already onto a restricted province here. So we have many layers of protection already here.
From CBC Radio Canada, Zoe.
Hello, I was wondering on December 24th, the province announced that there were at least 10,000 tests awaiting processing. Do you have specific number on that?
Yeah, right now that backlog is at about 11,500.
Thank you. My second question is about the self-administered rapid test available on some testing sites. We know that sometimes the test is negative, even if the person has COVID. So the person needs to do that test again hours later. Is that kind of information released for Manitobans on the website? Like the steps, like what do you need to do if you're negative, what you need to do if you're positive, and also the steps to follow for contact tracing, like your letters that people can send to their close contacts.
Yeah, and so no test is perfect. There's going to be false positive, false negative tests with any test that's administered. The rapid tests are no different. And so all that instruction is passed out to people coming. We want symptomatic people attending the test sites. They are provided with 3 tests and instructions on steps to take if they test negative or positive, and then again about notifying contacts.
From CBC Manitoba, Aaron.
Good afternoon, Dr. Rusin. You said that these restrictions are in line with what other provinces are doing. However, we do know that Manitoba is unique because at this point, we don't have a lot of ICU capacity. There are far more nurse vacancies, and we're not doing a great job of managing the rapid testing capacity there. Now you're saying that no one's home when they're testing positive. Do you think those people who aren't home when they're positive are listening to this news conference and taking a recommendation to stay home? I spoke with lots of people yesterday who are out and about Boxing Day shopping and talking about gathering with people over the holidays, and they said orders are stronger, that sends a stronger message than recommendations. So why not stronger orders today?
Well, there's a number of issues you brought up there, and so with testing and isolating when you're positive, I mean, we do have orders in that regard. I can't comment on who's listening to the press conference, but we do have a number of of orders out there, and so people getting getting tested because they have symptoms, but then choosing not to isolate. That doesn't really get addressed in orders. Really, it's about our public health direction. So we do need Manitobans on board. We've known that all along, but we have quite a number of restrictions, and I know we'll be seeing in the next later today and tomorrow just how difficult these restrictions are placing on certain businesses and Manitobans as well. So we try to find that balance.
Premier Stefanson, I also spent a lot of time at the testing sites last week and seeing so many people being turned away because the lines were so long, seniors waiting in line on foot and having to walk home to a house where there is others who would maybe also be symptomatic. People are getting frustrated waiting at home for the results. Now we're hearing 5 days. What was the explanation for waiting so long to start using these rapid tests, and what is the plan going forward to reduce some of these delays?
Yeah, so good question. I mean, obviously we put this in place now. We did a pilot project of utilizing the rapid test so that if someone comes in and they've been vaccinated but they're symptomatic, they actually get a rapid test, go home. If it's positive, then they come back for a PCR test. And so that has reduced the backlogs significantly, which is helping obviously to ensure that we get those results more quickly to Manitobans. And there was a couple of supply issues off the bat there at the beginning as well that we were dealing with, and so. But I think we've rectified many of those issues now, and so we're able to move forward so that those tests are available to Manitobans.
Faster.
From the Canadian Press, Rob.
I'm okay, my question's been answered.
From CTV Winnipeg, Mason.
Hi there. There are countless businesses, restaurants, museums, retail, choosing to close because of COVID-19 concerns. Does the government plan on having any other further supports, and what message do you give business owners who are acting more proactively than your government?
Yeah, no, thanks very much for the question. Certainly we did announce last week upwards of $22 million to help those businesses that were impacted as a result of the orders put in place 10 days ago. And those supports will apply here as well. We will always look to ensure that those businesses who are negatively impacted as a result of this will have the necessary supports in place. And so we'll continue to work with our partners in the business community to help them get through this. We want to see them get through this and be successful at the end so that we can get them back up and running and growing their businesses here in Manitoba. And that's obviously what we want to see moving forward.
Thanks for that. I'm not hearing any new restrictions for the unvaccinated. Why not? Aren't they the most at risk?
Well, they're already significantly restricted. So any private gathering that has any unvaccinated individuals can only have 5 in addition to a household. And then we have the proof of vaccine in most public settings. And so they're still unable to participate in those settings. So we already have quite a restricted province in regard to the unvaccinated.
From Global News, Will.
Well, good afternoon to you both. Dr. Roussin, I see these orders are set to expire on January 11th. Of course, I'm sure they could be extended, but what are you going to be looking for specifically before you're comfortable relaxing them?
So as we've been dealing with throughout, essentially all of this pandemic, the real concern is how this translates into the strain on the healthcare system. And so we're going to be watching that in jurisdictions that are ahead of us with Omicron transmission. We're going to obviously be looking at it in our jurisdiction. And so, the 11th, we always set our these type of public health orders with that expiry date to ensure Manitobans know we're always reviewing these and we'll only have the restrictions in place for as long as they're required. So there's a number of things we'll be looking at prior to these expiring.
Okay, thank you. Indications last week already were that cases were climbing. We had a press conference on Friday. Why not introduce these new orders then, or even sooner?
Well, so these orders right here are applying to the very large gatherings, and so we knew there was some, large gatherings being planned this week. We knew there was some larger sports events going to be planned early this week. So we were working to ensure that we weren't going to have very large, gatherings with thousands of Manitobans in there, and so this is where the timing led us.
From the Brandon Sun, Aaron.
Just with growing reports that because this Omicron variant is so contagious, we're going to have to rethink our masking and maybe go back to, say, KN95 or something progressive. Has the province considered changing the masking recommendations?
Overall, right now with the masking, we suggest the best fitted mask that you can obtain. So certainly a medical mask, a good fitting medical mask is better than a single layer cloth mask. We want people to do whatever they can to do that if possible. The KN95s, again, are not medical grade, the ones that we have been giving out. So they are much better than those cloth masks, a single layer cloth mask. But we've run into some trouble with the KN95s when people are attending a facility, like a medical facility where a medical grade mask is required, that the KN95 is not going to qualify for that. So we're looking at the messaging, but ultimately reducing our number of contacts, physical distancing, hand washing, using the best masks that you can have available, using it properly fitted is our advice at this point.
And just again, it's pretty much been talked about at length, but of course a lot of studies come out saying that this variant, yes, it's highly contagious, but less lethal. But I just said again, you are taking those as very preliminary and just going ahead with worrying about the strain, correct?
Correct. With the significant amount of numbers we're going to see, just the sheer absolute numbers of cases, even a significant reduction in severity could still put a significant strain on our healthcare system. So right now we need to focus on reducing transmission. As we learn more and more, we'd obviously be quite happy to have a strain that has a dramatic reduction in severity. we just can't rely on that right now.
We now return to the News Conference Theater.
Will there be widespread availability of rapid tests for the public at any time in the coming days or weeks? Like if I could just go to a pharmacy and pick up a rapid test to take home?
Yeah, I think certainly, we are working through Central Services, who's working along with the federal government, who is, in terms of the supply. To the extent that we can get this out, in a wider way for Manitobans, we want to work towards that. Obviously, looking at protecting those most vulnerable, we'll start off in schools and whatnot as well. But but I think to the extent that we can get more of these, we will distribute them more widely as well.
What's enforcement going to look like here over the next couple of weeks? Kind of the restrictions end on January 11th, so what's the plan for enforcement?
Well, I think we continue with enforcement as we have been. I know that the number of tickets that we gave out between October and the beginning of December have been more than any other province across Western Canada. And in particular, 70% of those have been given out in Southern Health. I think, I just want to commend those who are out there on enforcing these rules for their time, effort, and energy especially during the holiday season, and for the work that they do.
Why not set up like a portal or a phone line where people can report their rapid test result if it's positive, rather than having them come back and wait in line for a PCR test, again?
Yeah, and so these are things that we are actively looking at right now. We had a dramatic increase in the demand at the site, so we moved quickly with this plan, and so things like that we are looking at as well.
How is that something that could be done in short order? I'm just wondering, like for somebody who's sick and at home with a positive test result, they're not going to be feeling so good to go get a PCR test again.
Yeah, well, I'm not sure on the logistics of how quickly something like that can be turned around, but it is something that's being looked at.
With ICU, I want to go back to ICU admissions, because this is, of course, the limiting factor in so many things that that the pandemic touches on. So how confident, with the possibility of having 9 ICU admissions a day for COVID alone in the coming weeks, that's triple what we've done in the past. I don't know how this is going to, are you not as concerned, or is this not as urgent of a situation as it sounds?
Well, we've now introduced and expanded orders twice, since Omicron being in Manitoba. So we definitely feel it's urgent, and so we took measures twice now. We'll continue to watch it and do what we need to move forward. The healthcare system is working on their end and trying to increase capacity. And those numbers, we're watching other jurisdictions to see exactly what type of ICU demands they're starting to see with their increased numbers. So definitely it's urgent and concerning to us, and we've taken steps now twice to try to reduce transmission.
Just to go back to enforcement, when someone gets a ticket, how many people have actually paid the ticket? Do you guys have numbers on that?
I don't have numbers on those today, but we can certainly look into that through the Department of Justice.
Dr. Rusin, what happens to healthcare workers who test positive for this variant? Or do they take time off? Can they keep working? Is the system in danger of losing a bunch of people?
So this is the other impact on say the healthcare system, but on a lot of critical services when we have widespread transmission, is that yes, we will have severe outcomes which put strain, but then we'll also see people working in critical jobs that they might be out having to isolate even if they have mild illness. So as of right now, we make changes to healthcare workers who may have been in close contact. If they're double vaccinated, we can have them back under certain circumstances. And then of course, if we get under a lot of strain because of transmission, we may have to look at things like that. As of right now, we don't have a policy where test positives come back and work, but we might have to take steps if necessary.
One more, folks.
Premier, why were you not at the press conference on Friday? And I was just wondering if you have any thoughts on some comments on social media about your presence over the weekend, given the Christmas card that had the Remember and Stay Positive.
So, you know, I know Minister Gordon was here at that press conference on Friday, along with Dr. Roussin. I have tremendous confidence in both of those individuals, as well as I believe Dr. Reimer was there as well. And so certainly, you know, we work together as a team, and I can't be everywhere at every time. I know that I was busy with many of you last week in various year-end interviews, and that was you know, the time that I was spending there. But you know, I'll continue to do my part in all of this. Whether I'm in front of the camera or behind the scenes, I will continue to work on behalf of Manitobans as the Premier of this province.
Thanks, Claire.